Well, welcome everyone. Um, Good evening. Thank you for joining us on Tuesday evening for a session about the State of the Union when it comes to telehealth and physical therapy practice. My name is Tim Walston. I'm the Chief Digital Officer of Better PT, and we're so glad to have some guest speakers here this evening to share their insights. Justin Elliott will be speaking. He's the Vice President of Government Affairs at APTA, and his colleague, Alice Bell, who's also a PT, DPT, and she's the Senior Payment Specialist at APTA. And also, last but not least, my colleague, Marla Ranieri. She, as well, is a DPT, and she's our Chief Development Officer at Better PT. So this evening, we're going to go through a set of slides, walk you through some of the latest that's going on in the industry, and then we'll save some time, maybe about 10 minutes towards the end for question and answers. You'll be muted throughout the presentation, but at the point in which we'll have the Q&A session, we'll open mics to allow anyone to ask a question. If during the presentation you think of a question, please feel free to send it in, chat it in, and then we'll capture it and ask that question during the Q&A period. Alrighty. So without further ado, I will turn it over to Justin.
Well, thanks, Tim, and thanks everyone for taking time out of their evenings to join us tonight to talk a little bit about the State of the Union when it comes to telehealth. Again, my name is Justin Elliott. I'm the Vice President of Government Affairs at APTA. And my role at APTA, I oversee our political lobbying aimed primarily at Capitol Hill and our grassroots efforts. And I'm joined by my colleague, Alice Bell. And tonight we're going to talk a little bit from APTA's perspective about what's been going on in terms of the progress with telehealth from a practice, payment, and legislative aspect, and then give hopefully a forecast as to what we see happening maybe in the next month or so, potentially, by the U.S. Congress. And then we're going to turn it over to Marla, who's going to finish out tonight's presentation. So we can go to the next slide. And we can go to the next one. All right. So, I always like to talk when I talking about the issue of telehealth. It's kind of strange, it's one of those things now that we look at it from a pre-pandemic versus today. And I kind of said it like that because so much has changed at light speed over the last 6 to 7 months. Prior to the pandemic, the issue of telehealth was a strategic priority for APTA. It's actually something we've been working on for a couple of years now, looking to make sure that it is something to be recognized at the state level as part of the scope of practice that physical therapists and physical therapist assistants can utilize, looking at ways we can make it available across state lines through interstate practice, through the new PT Interstate Compact, providing resources and guidelines to practitioners and our members, promoting it to the public, and of course, talking to payers about the value of physical therapy, as well as the value of it being paid via telehealth. Now, what's interesting is, obviously so much of what drives the world is what Medicare does and what Medicare says. And prior to the pandemic, Medicare was pretty limited and kind of stingy on what they did with telehealth. Only a small handful of providers, primarily physicians, were allowed to utilize and then be authorized to get paid for telehealth services provided under Medicare. And there was a bill, and it's actually still out there today, that was introduced again prior to the pandemic, called the Connect for Health Act. And that was the first really big Medicare telehealth bill that APTA and a number of other groups were really advocating for, because it was seen as a great first step to adding new providers as being authorized to utilize telehealth under Medicare. And that was going to be PTs, OT, speech, a few other folks. And it would have basically said to CMS, you have the authority now to identify and authorize individual providers or practices who submit an application and want to be able to do telehealth under Medicare. And it's interesting, again, before the pandemic, the mood or the mindset or the perspective from so many folks on Capitol Hill, members of Congress, was a little bit of trepidation. They really were not sure they wanted to do a next big step in terms of expanding telehealth. There are a lot of questions. And of course, when it came to conversations we were having about physical therapy and the use of telehealth, them trying to wrap their minds around, isn't physical therapy a hands-on profession? How would you all utilize telehealth? And so it was kind of an interesting challenge in terms of getting this up and having momentum on Capitol Hill on the issue of telehealth. And of course, what we've seen over the last 6 to 7 months is tremendous adoption of the use of telehealth and payment of telehealth, both with Medicare and with private payers, and just also an acceptance that it's not a replacement, but it is certainly a nice option to have for patients and for providers. And of course, the main reason behind this massive expansion of telehealth is the response from the federal government, both Congress and HHS and CMS, in response to the national declared emergency and some of the flexibility that they were provided both from Congress and through CMS to expand, at least temporarily, the use of telehealth amongst some providers, and something that we are hopeful will hopefully become permanent. And we're going to talk a little bit about that a little later. But we can go to the next slide. So on this slide, you'll see that if we go back in time to the March, April timeframe when things were really blowing up with the COVID pandemic, a couple things happened, which were really the catalyst for the expansion and use and acceptance of telehealth. The first is that there was a national emergency declared, an official declaration of a national emergency. When that happens, there are a number of things that occur with federal agencies, and there are, in this case, with the Department of Health and Human Services, they have what are known as waivers, which, when there is a declared emergency, they can implement these temporary waivers. And these waivers are meant to provide flexibility, get rid of restrictions, to allow HHS and the CMS to do some things temporarily to help out with whatever that declared emergency is, depending on what the emergency is. In this case, it's a global pandemic. Now, what also happened, which was critical, is because there was not any under the list of waivers that HHS had that they could utilize under a national emergency. There wasn't, they didn't have the legal authority to expand telehealth under Medicare. So what Congress did, and did rather quickly, is in a bill that was called the CARES Act, which some folks may be familiar with. There was language in the CARES Act that Congress passed that specifically said, HHS, we are now giving you the legal authority to temporarily add providers under Medicare to be able to provide telehealth services under the national emergency. And what happened then is, as soon as Congress passed the CARES Act, we saw soon and thereafter CMS and HHS saying, okay, we're now adopting a list of new providers who will be allowed to temporarily provide services via telehealth under Medicare. PT, OT, speech, audiologists were just some of the providers who are now added to be able to provide services under telehealth. And what you see on the screen are just some of the things that were added. Obviously, the big one is telehealth visits under Medicare, PTs, and both PT and PTA services were provided or added to it. The virtual check-ins, the brief consultations that are done on phone, primarily through phone call, were also expanded to include PTs. And we can go to the next slide. We also saw the addition of the remote evaluation of recorded video or image. Again, this was something that they expanded to include PTs. And of course, the e-visits, which is basically communication between the patient and provider through an online patient portal messaging system. Again, these were all added very quickly back in the spring, and PTs were now able to utilize and have been utilizing these services via telehealth. We can go to the next slide. In addition, CMS acted somewhat quickly, although we were telling them to hurry up. They did add back in the late spring some recognition of codes that they will pay for under Medicare. So it's one thing to get PTs added as authorized services under Medicare under the national emergency. CMS then had to also say, okay, and these are the codes that we will specifically pay for services provided via telehealth. And I think what this did with Medicare, at least temporarily, acknowledging and expanding services under telehealth, really did have a cascade effect. We soon saw the impact that this had with private payers, with state Medicaid following suit, and really has been something that kind of lit a fire in terms of expanding the use of telehealth. We have seen more progress on the adoption and payment of telehealth in the last 6 months that we thought we wouldn't see for 6 years. It has really put it on light speed. And the issue is now, how do you get this? Will Congress or CMS, they're not going to be able to put this genie back in the bottle because it's been utilized pretty quickly. And we're going to talk a little bit about that in a few minutes. But first, I'm going to turn it over to my colleague, Alice Bell, who's going to talk a little bit more about the impact of payment and practice and how this has impacted the use of telehealth throughout the country. So Alice, going to turn it over to you.
Thanks so much, Justin, and good evening, everyone. And you can go to the next slide, please. So as Justin said, APTA has been involved for some time prior to the public health emergency in looking at opportunities for physical therapists to utilize telehealth within their practice. And APTA has had a position on telehealth for several years. And many of the things that we have focused on are on this slide in terms of the opportunity for seeing reductions in cost, for reductions in disparities, in particular access to physical therapy in areas where that access is more limited, or for populations for whom access is more limited, or where there are personnel shortages. Also, the ability to enhance practice, education, and research by utilizing telehealth. We've also long held the position, and this remains a very critical issue, that in order for telehealth to be effective, particularly in addressing many of those disparities and shortages issues, we have to look at the expansion of broadband access. Interestingly enough, the same populations that struggle with access with face-to-face care, we have found are struggling even with the broader adoption of telehealth because of limited broadband access. The one thing that was kind of the saving grace through this public health emergency was the expansion and the recognition of telephone-only services, which had some ability to address need, but certainly not in the most effective way. And APTA is engaged right now in developing best practice guidelines around telehealth. We have developed many, many resources over the years, but as Justin said, with this very rapid adoption, we have rapidly been deploying many more resources, and also recognizing that this is here to stay. The extent to which it is permanent is still uncertain, but we know for certain that there will be a permanence to telehealth at some level. Next slide. The thing I really want to stress tonight as we talk about kind of the movement toward permanent adoption is that this is a complex issue, and some of the complexities were eliminated during the public health emergency. We've pretty much been engaged in one of the largest forced pilots, I think, that's ever occurred for many healthcare practitioners in terms of this foray into telehealth. But it was done with the relaxing of a lot of requirements. We saw relaxing of HIPAA requirements. We saw relaxing of technology requirements. We saw some greater leniency around policies and procedures and some of the legal issues associated with telehealth. As we move out of the public health emergency and many of these waivers go away, it's going to be really, really important for providers to recognize that many of the rules that were temporarily suspended are coming back. And many practitioners have only practiced telehealth under these kind of looser guidelines. So important to really make sure that people review all of their state laws and regulations, including their Practice Act. There were many laws already on the books prior to the public health emergency and state practice acts that spoke to telehealth for physical therapy, but there were many that did not. And many of the laws that were passed and the modifications that were made are temporary. And as soon as the PHE goes away, so do these laws and adjusted regulations, if you will. So keeping a close eye on where that's going. Some of the things to think about are the responsibility for and the appropriate use of technology. As I said before, we've had a lot more license with the types of technologies that we've been able to use. Verification of patient identity, informed consent. That varies a great deal by payer policy as to whether that has to be a written consent or a verbal consent, whether it has to be with every visit or for the episode of care. Standards of care, privacy and security of client records and exchange of information, what your emergency procedures are should an emergency occur during performing a telehealth visit. So there's a lot to be looked at in terms of policies and procedures that we may have not dove so deep into during this temporary situation. And I'm going to talk a little bit about payer policies. Next slide. So as I said, and as Justin said, this rapid adoption, we've seen a lot of activity at the federal, state, and commercial payer level, but many of these policies are temporary. And so when we look at continued coverage under Medicare, we're going to have to see congressional action, and Justin will talk about that. Continued coverage under Medicaid will require permanent state action, permanent adoption of some of these temporary allowances and permanent laws written. And commercial payers will need to adopt permanent policy changes. Now, we've already seen that start to happen. And I'm going to go over a few policies just to give you an idea. But many of the commercial payers still have either identified specific dates for expiration on their policies, or they've linked the expiration to the termination of the public health emergency. Next slide. So APTA, from the outset, we've been actively engaged in advocacy efforts for the rapid adoption of telehealth under the PHE, and we moved very quickly into advocacy for more permanent adoption. So we are targeting CMS and Congress, and again, Justin will talk more about that. We are collaborating with our chapters to look at state level action and how we can support chapters in adoption of state laws that make this more permanent. And we have been working very, very closely with the large national commercial payers all through this in terms of leveraging our relationships and contacts and submitting proposals for model permanent policies and working closely with those payers to look at whatever data is available so that we can help to make determinations about the best permanent adoption of policy. Next slide. So just to give you one example, one kind of early state level action was in New Hampshire. So New Hampshire House Bill 1623 FN was a permanent policy. So this was after they put in place some temporary provisions for telehealth during the PHE. They moved toward permanent adoption about 2 or 3 months ago. And this bill specifically includes physical therapists. And the nice things, kind of some of the key pieces in this this bill are the fact that there's no restrictions for originating in distant site, which was one of the major problems under Medicare, were the originating site and distant site restrictions, which really limited telehealth. And then the other thing that's included in the New Hampshire House bill is payment parity. So payment must be equal to payment for services if they were delivered in person or face-to-face. So there's some very nice provisions in this bill. And we expect to see more and more state activity. This was just one example I wanted to share with you, and they were definitely an early adopter post-PH or during the PHE. Next slide. Now I want to go through some of the commercial payer action. And As you all well know, commercial payer policy is complex enough under our historical models and face-to-face and in-person care delivery in terms of every payer having their own nuances and their own specific requirements. And if anything, telehealth only makes that a little bit more challenging because there's so much potential variability in what a payer can deem to be coverable, under what conditions, using what codes, using what modifiers, using what place of service code. In the case of institutional or home health providers, what revenue codes. So here's a few that have come through in the last probably 30 to 45 days. AmeriHealth and Independence Blue Cross of PA has adopted a permanent coverage policy for physical therapists. The services have to be provided to established patients. They are taking away the e-visits and virtual check-ins, so those will not be eligible for reimbursement moving forward in the permanent policy. There are some restrictions on revenue codes, but they have a pretty expansive list of CPT codes that they are going to cover. So these are the exceptions to their coverage, not their coverage. So the cognitive codes are accepted for these payers. They are only approving the low and moderate complexity evaluation. They feel that meeting the requirements of a high complexity evaluation requires in-person and face-to-face. As you can see, they've taken out therapeutic activities, they've taken out orthotics and prosthetics, but they've retained several codes and allowed for evaluations to be performed via telehealth. Next slide. Now, if you look at Paramount Advantage, this policy, which is in Ohio, they've specified the modifier. The interesting thing with the modifiers is GT and Modifier 95 are very, very similar. The difference with Modifier 95 is that it applies only to CPT codes that are in Appendix P of the CPT manual. None of the physical therapy codes are in Appendix P, and the reason for that is in order for codes to be acknowledged by the CPT manual as telehealth codes, there have to be permanent payer policies with the codes specifically identified. So until now, we didn't have that. We will be moving to getting our codes included. But without that, generally GT is the modifier that we would use. These are the codes now they will cover, and you'll see for this payer, they are retaining some of those virtual codes, the virtual check-in and the virtual review of images. And they are keeping all of the eval and re-eval codes and a pretty expansive list of treatment codes. Next slide. Blue Cross Blue Shield Rhode Island, which was one of the first to adopt a permanent policy that'll be effective 1/1/21. Again, they've specified their place of service. Under the public health emergency, many of the payers said use the same place of service that you would use if you were providing in-person care. So it was generally 11. But Rhode Island moving forward is looking at the telehealth place of service and the codes. And I only put all this up here to just kind of reinforce that if you've seen one commercial payer telehealth policy, you've seen one commercial payer telehealth policy. And it will be important as you move forward to really know the specifics of each payer and what they're adopting. Next slide. And Blue Cross Blue Shield of Montana has us living in the gray area right now. They have adopted a permanent policy. They have identified 2 codes that physical therapists would routinely bill. However, they have not included physical therapists as eligible providers, but their eligible provider list is captioned by including but not limited to. So you couldn't get any grayer and it couldn't be any more limited in terms of codes. So this is just an example of kind of the broad variance that we're seeing in these policies. And APTA has a very standard policy language that we are aggressively working with commercial payers on, and we're hoping where we see these very restrictive policies, we'll be able to influence those policies and make them broader as we move forward. Next slide. So Justin, I'll hand off to you now.
All right. Well, thanks, Alice. And as you can see from Alice's presentation, we're seeing those commercial payers beginning to move to make this use of telehealth permanent. But of course, the big one that we need to make sure adopts it permanently, of course, is Medicare. And so, as I mentioned before, the ability of PTs and other providers, OTs, speech audiologists, to utilize telehealth under Medicare. Right now, we're doing it under the national declared emergency, the public health emergency. When that national emergency is declared over, all of the temporary waivers that were granted back in the spring, including the expanded list of providers who can use telehealth, goes away. So there is a scenario, unless Congress acts, that when the public health emergency is declared over, let's say it's 3 months, 6 months, or a year from now, that we could lose, conceivably, possibly, all the rights that we've gained in the last 6 months under Medicare. Now, the good news is, well, not the good news, but I would say that it is, we don't anticipate that being a scenario because, first of all, is that it would appear at this point that there is no indication that it's going to be declared over, unfortunately, for at least probably the next year. And so I would say in terms of outlook, we anticipate that we'll have these temporary ability to continue to utilize telehealth probably until the end of 2021. And that would probably be right when we would expect, that we might potentially see it being declared over. Again, that's all based on what happens with the distribution of any vaccine and how the trend lines go with the current pandemic. But while we are grateful we have this temporary ability, we do need Congress to act to make it permanent. So let's go ahead and go to the next slide. So there are a number of bills that we are working on that APTA and our members are advocating for. I mentioned that before the pandemic, we had the Connect for Health Act, HR 4932, Senate companion bill with Senate Bill 2741. APTA did endorse this. We were advocating in support of it. It's a perfectly fine bill, good bill. The issue, though, is it actually is, if this was to go through, would actually be a step back from everything we've gained through the temporary waiver under the declared emergency. We want to keep what we've got. We don't want to take a step backwards. And while the Connect for Health was good before the pandemic, too much has changed to really have that be our first go-to bill. But we do have 3 bills actually that are currently being considered by Congress or will be considered by Congress. The first is a bill called the Telehealth Modernization Act. In the Senate, it's Senate Bill 4375, is introduced by Senator Lamar Alexander of Tennessee. He also happens to be chair of the Senate Health Committee. This is a bill that it's interesting. What it would do is basically provide permanent legal authority to the Secretary of HHS to add providers as he or she sees fit. And so while it wouldn't specifically add PT, OT, and speech, basically what it would do is after the pandemic is over or before the pandemic is over, if this bill was to be passed, the Secretary of HHS could then adopt a regulation to say, well, when the declared emergency is over, we're going to keep PT, OT, speech, and these other providers as qualified providers to do telehealth under Medicare. So it'd be good because it would provide that opportunity, and we certainly would anticipate and expect that the Secretary of HHS would add therapy services and therapists as permanent providers under telehealth. The other legislation, I should be noted that the Telehealth Modernization Act, the House companion bill was just introduced this week by Congressman Buddy Carter from Georgia and Congresswoman Lisa Blunt Rochester of Delaware. And so that we now have a House companion that is in play. We also have a bill called the Commitment to Defeat the Virus and Keep America Healthy Act, HR 14. This is a bill that was included in a House proposed COVID relief package. This would basically extend those providers through till 2023. Basically, it would ensure that we can keep these temporary provisions at least for another through the end of 2023. Again, we're not opposed to it. It's only a temporary patch. We want, again, a permanent solution. We do anticipate the third bill will be a bill that will probably be introduced this Monday, and that will be from Congresswoman Sherrill, a Democrat from New Jersey. Congressman McKinley, a Republican from West Virginia, bipartisan legislation. This bill would specifically amend the federal statute and list, under the list of folks where it says who are authorized to provide telehealth, it would add PT, PTA, OT, OTAs, SLPs, and audiologists. That's really what we want. We want explicit, specific authorization in the federal statute that says, yes, we can do it. Now, I say that we also, of course, do support the Telehealth Modernization Act. It's a good bill, but the legislation from Cheryl and McKinley is also good. So let's look at the timeline for when this needs to happen. We could go to the next slide. So we are coming to the end of the what's known as the 116th Congress. Congress goes into session for 2 years. The 116th session began in January of 2019. It will end on December 31st of this year, 2020. And so right now, we just started this week what's known as the lame duck session of Congress. Congress has a ton of work that they need to get done before the end of the year. And then what happens at December is Congress ends, that session ends. Any bills that are not passed by the end of December pretty much die, and they would need to be reintroduced in the new Congress that comes to town in January of 2021. That's when we begin the 117th session of Congress, and that will be for another 2 years through 21 and 22. So we're looking at, in terms of being able to get something done this year, there are a couple of must-pass vehicles that Congress has to pass in December. There's a bill called a continuing resolution that will prevent a government shutdown. They've got to pass that by December 11th, where the government will shut down. There's also a talk of a COVID relief package, a fourth COVID relief package, that this could, any type of telehealth fix could be added to. And then there's a number of other must-pass bills that Congress has to do before as part of their year-end business that we'll be looking to hopefully get some momentum to add either the Telehealth Modernization Act or the bill that Congresswoman Cheryl and Congressman McKinley will be introducing in just a few days, trying to have that added to one of those major must-pass vehicles. Now, if that doesn't happen, again, we don't anticipate the public health emergency to be declared over till the end of 2021. What that means is when the new Congress comes to town in January, we'll have to reintroduce the bills, get momentum going, and get them hopefully passed sooner rather than later. So we have a lot of excitement ahead in terms of telehealth. I think the momentum is there with Congress, a total sea change in terms of opinion, and it's really grown in popularity with members of Congress. And I think there certainly is a sentiment that they need to make these temporary waivers that have added PT and OT and speech and audiologists, that they need to make that permanent. It just makes sense. So stay tuned, because we will anticipate a potential action maybe in December, fingers crossed. But if not, we'll definitely be back in January to get this done. We go to the next slide. We do have a couple resources at apta.org dealing with telehealth and practice and payment, some information from CMS, and of course our advocacy that we are constantly doing with Congress on telehealth. We do have information not only about the telehealth bill, but if you go to APTA Advocacy, you can see a wide range of issues that APTA is advocating to support our members and the patients that we serve. And we can go to the next slide. And actually, we're going to go to the next, and then I'm going to go ahead and turn it over to Marla.
Great. Thank you so much. Alice and Justin, that was great. I really appreciate hearing about that and seeing what's coming and all the hard work that you guys are doing in Congress to be able to continue telehealth and allow it to be part of our practice as physical therapists. Kate, you can go to the next slide. So now I'm going to talk about innovative ways to incorporate telehealth into your practice. I know we all did this as part of the pandemic, but it's a tool in our toolbox that we can use as part of our practice from here on out, regardless if there's a pandemic or not. And so we're going to talk about how to use it for patient safety, regardless of the pandemic, to provide even better care, to offer cash-based services, to use it internally within our company, and to reach more patients. Next slide. So just a background, I am a physical therapist. I'm also the Chief Development Officer for Better PT, and that is a telehealth platform and an online scheduling platform. And we have partnered with the APTA to offer telehealth to APTA members, in addition to physical therapy practices throughout the country. Next slide. So what I believe is that telehealth should be 20% of your practice. And that's not just your already existing practice and caseload, that's 20% extra. A lot of you may say, this is crazy. You really only saw your telehealth spike when people didn't want to come to the clinic. And then now as people are coming to the clinic, you're seeing your telehealth go down. I don't believe that's the case. I think telehealth should continue to increase and spike because you can use it as many different ways to service your community, and you can really help it to grow your practice beyond your doors and your physical facility. Next slide. So how is that? Well, of course, safety. Even if people aren't dealing with COVID, there's going to be people who have the common cold and who just don't want to come in. Things are going to change from here on out. Anyone who has a cough or some allergies are going to be reluctant to go to public places. So those patients who feel good enough to do therapy, but maybe don't want to come into a public place are still going to benefit from telehealth. So when someone calls and cancels, you can just turn them into a telehealth visit instead. There's going to be that elderly at-risk population that does not feel comfortable coming in for a while and is safer for them to be home. So that population you can still reach out to with telehealth. You're also going to have to comply with social distancing. As we see winter months coming, it might go back to where you have to have less percentage of people in your clinic at one time. So a lot of people think then this changes your caseload, but it shouldn't, because what you can do is have the same caseload, but just have maybe 2 sessions come in the clinic for that patient and 1 telehealth session, or 1 in-clinic session and 2 telehealth sessions. So that way you still are offering them their plan of care, but it's just a mixture, and you can keep your decreased percentage of people within your clinic. I also feel that it's going to be great for pre-op and post-op visits. So a lot of people don't want to go to the hospital multiple times, but they still want surgery. So you can connect with the doctors and say, let me do your pre-op visits virtually. I will cover that patient before they see you, let them know about crutches, their exercises, what they should be doing in the meantime. They see the doctor for their surgery, and then right away, you as the PT jump right in to review their exercises post-surgically and then get them into the clinic. I also think it's going to be a great way for family members who want to be part of the session but can't come to the clinic to be there because of social distancing, or because maybe that family member's in at-risk population and they don't want to see the family member. So you can absolutely do telehealth and include family members from all over to be able to help and watch and see and be part of the session. Next slide. Other ways that you can use telehealth regardless of the pandemic is for cancellations. Let's say there's a big snowstorm. Normally you call everyone hectically in the morning, canceling all your visits. What you should be doing is just shooting out telehealth visits to everyone and saying, due to the inclement weather, we're going to go ahead and change you over to telehealth. So you still capture that entire population, but you do it safely through telehealth. Also for niche practices, you might have some amazing therapists, maybe your TMJ therapist or your pediatric specialist. And right now, you can only reach the doctors around you, but with telehealth, you can go to doctors throughout your whole state and say, I have the best of the best in my clinic. Feel free to send your patients to us. We can start with telehealth, maybe bring them in once or twice, but continue through telehealth. And therefore, they can live an hour to 2 hours away and we can still service them. I also say during a patient's follow-up visit with doctors. So you might have a new patient who comes in and they're from a doctor you've never heard of or seen before. What you can do is offer that patient a telehealth visit when they go back to their doctor. So you're physically in the doctor office with that patient. Not only are you going to be able to update the doctor about that patient, you're going to be able to listen to their visit, and you're also going to be able to meet that doctor and show the extra mile that you're going to be part of that patient's plan of care. So that's a really, really unique way to use it, and I think a way that you can connect nicely with all of the community. You also can use it for people who are at home and they just can't get out of their house. They've got maybe kids homeschooling right now. Maybe they're busy working and they just can't get to the clinic. That's somebody who's going to take advantage of telehealth, especially if their injury isn't detrimental. It might just be an ankle sprain, or maybe it's starting to be a back twinge. People are going to use telehealth in that scenario because it's more convenient for them. And you always can convert them into the clinic. But this is a way of accessing those patients who just really can't make it to you, but now you can make it to them. You can also do it for that patient who is non-compliant and fell off their plan of care. So maybe, they came a few times and then you never saw them again. Well, instead of having your front desk call them and saying you need to make a visit back in the clinic, you could say, hey, let's do a telehealth visit for your next session, because they might be more likely to say yes to that and you get them back engaged than coming back into the clinic. You also can do it for patients that, let's say you don't have an available appointment for 2 weeks for an initial evaluation, but you want to get them in right away. Well, great, have a telehealth specialist and get those patients started. You know, we all know the sooner you get on your plan of care, whether it's virtual or in clinic, the better you're going to be and the more compliant, because you're getting treatment right from the start. So get that patient started right away through telehealth, bring them into the clinic as soon as you can. And also as a lead gen tool, you know, on your website, you should have call to actions, request an appointment, request telehealth. You know, people might be perusing through your website and maybe not sure about their interest level, but if they see that on there, they might be more likely to go ahead and do a telehealth visit than come into the clinic. And that's something Better PT does really well, is we do offer a call to action right from your website so patients can schedule telehealth with you through your digital world. Next slide. You also can use telehealth to provide even better care. Believe it or not, there are things you can do better through telehealth that you couldn't do in the clinic. So for example, you know, maybe for an interpreter to join, you can actually have somebody seeing the session, somebody interpreting, and the patient seeing the interpreter, and vice versa. And that really becomes a stronger interpretation than just a phone call where everyone's not really sure what's going on. It's also really great for patients who can't remember their session. You can say, let's do your next one as a telehealth. We're going to video record the whole session. You're going to be able to keep that video recording, watch it for 2 weeks, follow it, and then in 2 weeks, we'll do another telehealth and record the updated session. So this is great for some of your elderly patients who can't remember their plan of care. And every time they come back in, they look at you like they never learned that exercise before. So use it that way as well. You also can do it for those free assessments that you do. So a lot of times, you know, you say, hey, come on in, you know, we'll see you as soon as you're injured, we'll do a free assessment. Well, maybe you reach out to those athletic directors, you know, those gymnastics teams, and say, if you get injured right away, I could do a free telehealth assessment. We can tell you if you need to see a doctor or come right into us for physical therapy. You could use it for on-site acute care. Very similar, you know, connect with local sports teams, connect with local athletic trainers, and say, you know, as soon as something happens, if you have a question, if your participants have a question, we can connect on a telehealth call and we can help you out and make sure to bridge that gap. You can use it for communication with other medical providers. Maybe you have a patient coming in who is also seeing a massage therapist or an acupuncturist. And you can say, great, the next time you're with that massage therapist, let's set up a telehealth call so I can tell them about what muscles I want them to work on. I can give them an update and we can really communicate as a team about the patient. You can use it for check-in visits, post-discharge. You know, maybe you have that ACL patient that you've discharged, but you really want to check in 3 weeks. So on that discharge date, you can say, you know what, I'm going to set up one more telehealth session from 3 weeks from now. We're going to check in. If you're doing well, then you're discharged. If not, we'll bring you back in. You also can use it for patients who want to learn how to use their gym equipment. So they're in the clinic with you and they keep asking you what I should do at the gym or my home office. And you say, next session, let's set up a telehealth inside your gym, inside your home gym, and I can show you how to use the machines that are unique to your gym and make sure that you're using them right. Next slide. You can do it for cash-based services. Let's say that all of a sudden insurance doesn't reimburse telehealth. Well, telehealth is still a great way to reach out for wellness visits, for home safety evaluations, you know, for ergonomic work assessments, for functional assessments. These can all be cash-based services, and you can actually hire just a per diem telehealth therapist to do all this for you. So if somebody comes in and they are a little bit of a fall risk, you can say your next session is a home safety evaluation. We're going to go through your whole house. We're going to make sure we tell you which rugs to pull up, what pathway you should clear, and really make sure that you're as safe as possible. For those back and necks, we're going to do an ergonomic work assessment. We're going to show you how you should be sitting at your desk, how you should set it up and change it. And this is all something you could do better through telehealth that you can't do in person when they come to the clinic. You also can watch them do their job. You know, what's still hurting them? Great, let's do a telehealth session with you at your job. with you picking up your baby from the crib. And I'm going to be able to really provide you the correct guidance and movement patterns through that telehealth session. And of course, return to sport assessments. I know we love doing running assessments in the clinic, and we can do that, but there's some sport assessments we can't do in the clinic. Maybe it's that gymnastics individual who's going back to a round of my handspring double back that you have no idea what that is. Great, let's set up a telehealth visit. You're gonna show me that skill, I'm gonna watch it, I'm gonna evaluate your movement, and I'm gonna help you get back to your sport. Next slide. You also can use it internally for your business. You might have some fantastic therapists in different clinics. So telehealth can actually allow therapists in one clinic A to observe a therapist in clinic B, treating a tricky patient that therapist A has never seen. So you really can use it in that way, training internally, training your therapist, mentoring sessions, being able to offer a patient that's really tricky in one clinic to see your specialist in another clinic through telehealth, and then convert back to treatment with that same therapist. So there's a lot of great ways you can use it internally. Residence programs. You can use it for clinical affiliations for students. Maybe they can't come out to you right now, but they can sit on all your telehealth calls. And you also can use it for extra per diem hours or opportunities. Maybe you have that therapist who can't come back to the clinic because they have to stay at home with their kids. Well, great, give them some extra per diem hours and they could be your telehealth the specialist. Next slide. So point of the matter is, telehealth is a tool in your toolbox, and it's a great way to provide a service to your patients, and sometimes even a better service to your patients, and reach them where they need it. So think about growing beyond your bricks and mortars, extending your doors, and reaching more patients than you would have ever before. Next slide. And of course, when you're looking for a telehealth platform, it's really important that, as Alice said earlier, the regulations were lifted, but they're not always going to be lifted. You need to start thinking long-term. You need to get a platform that actually works with your clinic, that's safe, that's HIPAA compliant, that you sign a BAA with, that's secure. You should have a platform where the patient can actually request an appointment from your website or your email. You should have a platform that allows ease of access for the patients or providers. So a click of a button, not having to download a whole app or create an account. All of that makes you lose patients along the way. You should definitely have automatic reminder systems, automatic sign-offs on consent to treat for every session, audio video recording option, flexibility for more than 2 parties to join the call for interpreters and students and guardians, and just really simple and affordable. And of course, next slide, Better PT does offer all this. We also offer membership benefits for anyone who's an APTA member, and we really have done a fantastic job servicing the industry for physical therapy providers, as we're created by physical therapists for physical therapists, and our goal is to be able to offer you ways to reach your patients and get them better. Thank you. And I don't see any current chat questions, but please feel free, reach out. Okay, looks like they're coming in.
So I see this one about the 95 modifier. So it varies. What we saw in the temporary policies, where many of the payers said use 95, even though the codes were not in Appendix P. I think many of them did that was because that's what their systems were set up to accept. And I think moving forward, we may still see some commercial payers that say 95. For Medicare, that 95 modifier is only for the codes that are in Appendix P, and otherwise you use GT. So it is going to be, I think it's going to be very payer specific. As I said before, I think when you see one policy, you've seen one policy, and we probably saw about a 50-50 split during the public health emergency between payers that said use 95 or payers that said use GT, or either or. I hope that answered your question.
New York in the 80s was this fabulous melting pot.
It was good. It was a playground.
Okay, so yes, when you're providing telehealth, and we're getting some background noise, so just when you're providing telehealth right now, as we sit here today, you have to be licensed in the state where the patient is. Now, if there's compact in place and you can get compact provisions, that works. But for the most part, we didn't see states relax those practice requirements. So as we sit here today, you need to either be licensed in the state where the patient is, or check and make sure whether there's any of the provision that the state has provided that would allow you to cross state lines for providing care. The point about individuals with hearing loss or memory issues, this is like anything we do as PTs. Marla did a great job of highlighting all of the things and the benefits of telehealth, and they are deep and broad. And at the same time, it is not the right thing for every patient. And it's our responsibility as the treating therapist to determine whether this is an appropriate tool to take out of our toolbox. But we also need to be innovative and need to find ways to use tools that we may otherwise never have used. I think it is important to know that for many therapists who've never practiced telehealth, this is a new skill set. The whole idea of communicating via video, being able to direct a patient, feeling comfortable with that, for patients to know how to use the technology, position the camera correctly so we're not looking at someone's forehead during the session. All of those things take time, and but it's worth the investment if it's going to be the right tool for the patient. But definitely challenges when there's language issues, when there's communication issues, when there's behavioral issues, when there's low vision. There's definitely things that you're going to have to look at each patient and say, how can I leverage this tool, or can I not leverage this tool for this individual?
Absolutely agree. And just to couple on that with Alice, you might need to train your therapist on how to do telehealth. Some people weren't comfortable right off the bat, and there are consultants out there who will take you and train you. I know one of them is on our call today, Daniel Seiler from TelePT Solutions. He will go ahead and teach everybody how to do an eval, how to set your clinic up correctly, how to make sure you're comfortable with evals and follow-ups and the right patient to choose. So utilize those resources. They are out there for you.
Yep.
And I see there's a question about payers willing to credential providers who offer services solely via telehealth. The thing that gets a little tricky here, and I think that we have to be very mindful of, again, as licensed practitioners, is that in most every state that you look at, patients have the right to opt out of telehealth at any point. And so if you don't have either a physical site where you can see that patient in person, or if you have not made arrangements with a provider to whom you can refer that patient, should they choose to opt out, you could find yourself in a place where your patient has a need and you are not meeting it, and you have an obligation to meet that patient's need. So I can tell you that right now, in most cases, I think the expectation is that the therapist will have the ability to direct that patient to in-person care should they opt out, or should an emergency arise or some change in condition that would indicate that they no longer can engage in telehealth. And I think that's going to be a kind of a tricky area to say, this is all I do, and I have no other option for the patients that I serve. So I just put that out there, and you're going to have to look at state laws and payer policy, but I think that's a difficult area. The other thing I just want to really point out is we need to be very hyper vigilant about distinguishing between a platform for PTs to deliver telehealth and some of the products that we're seeing emerge on the market, like different exercise apps and technologies that are purporting themselves to be substitutes for physical therapy, and are really simply just exercising monitoring devices. So really be careful about what you're talking about when you're talking about telehealth. And as Marla has indicated, and as we strongly reinforce over and over again, it's not physical therapy if there isn't a physical therapist involved at the other end of the session. And so I just want to make that distinction.
Great, great. And I think we have a question from a little earlier that says, how can a provider know where the patient is remotely located? I highly encourage that in the beginning of every session, you do ask that question. It should be your entry, just like as when you get a patient in the clinic, you ask your main questions as soon as they come in, because if that patient does go down and they do faint or something happens, you do have to have a plan to be able to get care out to them. So it's very important. And of course, if you have that recording feature, I think that there's a lot of benefits on using the recording. Of course, if you have consent from the patient, but of course that for all of those different reasons, if you forgot where they were located, you have it on the recording and you can go quickly access it.
And while we wait for additional questions, I was just going to make a pitch for the Physical Therapy Interstate Compact, which came on the scene a few years ago. Over half of the US states have passed the legislation to become members of the PT Interstate Compact. And it really was designed when it was created to facilitate interstate practice of telehealth, but also help PTs who are traveling PTs, PTs like here in DC, where you have physical therapists who have to hold licenses in Virginia, Maryland, and DC. The Interstate Compact is a great option for those states that or are participating members to be able to, instead of having to hold and maintain another license, you're able to go on site or go online, choose states that you want to get a compact privilege from. It's treated just like a license. You don't have to worry about the continuing education requirements in the different states, only your home state, and it's cheaper. So if you haven't checked it out, be sure to go to ptcompact.org, check to see if your state's a member of the compact yet, and learn how you can get these and obtain interstate privileges to practice.
And it looks like there was a question earlier on about telehealth promotion and marketing. And I think this is very important because people need to know you're offering telehealth, right? So of course you should have it on your main page. Like we said, that call to action button that says request telehealth, and it goes directly to you guys, you know, your ability to let patients know throughout your digital world. So your Google My Business, they actually added a spot on Google My Business for virtual care that you could put a link right directly in. It should be on your Facebook, on your Instagram. You should have QR codes that you give to doctors, and that the doctors are able to, when the patient puts their phone up, they're able to connect directly with you for either telehealth or in-clinic care. You should also be sending out newsletters to your entire patient caseload, letting them know you're offering telehealth, and that should come out kind of frequently, because there might be a patient who didn't need it and they forgot about it, and now they do need it. So you really do need to be your advocate, but having the technology behind you to do that, you know, Better PT could really help you with that. In a sense, it's important to make it easy for them to access you and to know you're offering telehealth. All right.
That was an hour. So just want to thank everyone again for joining. We will be following up with an email that will have a link to this presentation. So you will be able to download it and then review it. And we ask, you might want to share it with some of your colleagues as well. So thank you again for your time, your participation. We really appreciate it.
And Tim, I just want to say on behalf of APTA, thanks for having us tonight. We know that so many therapists have been on the front lines during this pandemic, and the stress and anxiety and challenges that you all have faced. Telehealth has been a critical tool to get us through these very difficult times, and APTA is going to continue to fight for this, for our therapists, for our patients. So thank you for all who joined, for all that you do, and thank you for your membership in APTA.
All righty. Well, thank you, Justin, Alice, Marla.
Thank you.
Thank you. Good night, everyone.
Good night, everyone.
All right.